At 10 tonight, a Fox 8 exclusive. Our cameras take you inside the Centers for Disease Control's Emergency Response Center.
Well, Fox 8's Melissa Reed talked to a leader of the National Ebola Task Force and got the latest on the investigation in Northeast Ohio. She has more tonight from Atlanta.
That's right. I'm here at the CDC, and this is where they've activated an emergency operations center back on August 1st to tackle Ebola. Over 700 miles away from Northeast Ohio is the Centers for Disease Control in Atlanta, Georgia.
Is this going to be Ebola centered? Is that the purpose of the training?
And inside the CDC is an emergency operations center that is currently battling the Ebola virus.
This is the CDC Emergency Operations Center. We are working hard to get new information, especially new guidance out to the American people.
Dr. John Brooks is lead of the Medical Care Task Force at the CDC's Emergency Response for Ebola.
You know, we believed our guidance at the time is the best it could have been and was appropriate for folks. It's evident from what's occurred that we need to rethink that.
And at the root of an investigation is 29-year-old Amber Vinson, a Dallas nurse diagnosed with Ebola after a visit to Northeast Ohio.
Our team on the ground in Ohio, up in Akron, has been interviewing all the contacts of Amber to try and understand who may have had contact with Amber during the time that she was infectious to others.
Vinson flew from Dallas to Cleveland on October 10th to prepare for a wedding. She flew back October 13th.
This isn't like the flu or like HIV, where there's a period of time that you are asymptomatic but yet can pass the infection to others. In this unusual disease, the only way that you can infect other people is when you're symptomatic. So one of the key priorities of our investigation up there is to figure out when was she symptomatic and then who are the people with whom she may have come into contact.
And when asked why the CDC allowed her to fly, Dr. Brooks didn't answer. Vincent was a nurse for Thomas Eric Duncan, who died from the disease.
Mr. Duncan had very intimate contact with his family, and yet contact also with the healthcare system, where the nature of the contact due to infection control practices was different. And yet someone in the hospital system became infected, but family members, as far as we know, and I believe we're at the end of the 21-day incubation period, so they haven't developed symptoms. This is a call for us to really investigate what's going on. We've got to figure out what was different here.
How could Amber have gotten infected by this?
I don't know. I don't think anybody knows right now. It's easy to speculate, and when there's a lot of fear, people speculate a lot about all the different ways that this could happen.
Meantime, Amber Vincent remains in isolation here at Emory University Hospital in Atlanta. Emory is one of 4 hospitals across the United States that specializes in treating Ebola. The CDC does confirm Vinson made several stops throughout Northeast Ohio during her trip. Their investigation so far reveals no need for concern.
Her having picked up an item in a grocery store and then placed it back on the shelf, this is a potent virus, but it's really weak in the environment. And if it gets exposed to ultraviolet light, if the temperature changes, if the surface of everything dries, it doesn't last long on surfaces.
And as to whether Northeast Ohio should expect this to get worse before it gets better,
we've identified, we think, all the people who may have had contact with her. These people are being extraordinarily generous with us as a society by stepping back and quarantining themselves so that we can make sure that if in the unlikely event one of them becomes ill, that it's not transmitted to somebody else.
the CDC continues to monitor dozens of people who were in contact with Vincent. However, they say there are no confirmed cases of Ebola in Northeast Ohio. In Atlanta, Melissa Reed, Fox 8 News.
All right,